Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the YouTube channel today. Once again, reminding you that if medication fixes your problem, that makes it a medical problem, not a mental problem. I saw a gal earlier this week who, it's a success story, but it's also a discussion about, how you feel when you're having success. And her opening quote was, "I'm great, I'm doing so well. I just can't believe it took me 40-something years to figure this out." So a little bit of regret there that she hadn't met me earlier and we hadn't done what we did to help her earlier. What we did for her doesn't really matter, except for the fact that she had a brain chemistry abnormality that, she was here and now we have her here. And when she's here, she's not good. And when she's here, she's good. So we were talking about the channel and sharing the ideas from the channel with her family and friends because she's excited and she wanted to share a lot of stuff, and it was important for her to convey the information to her family so that they would understand better. And there was elements of lots of things that I won't really disclose because it's personal to her. But the fact is, patients' families and friends oftentimes don't understand this stuff. And the channel has been a mechanism that I've used to help people to understand it. Well, sometimes that works, and sometimes the patient it just falls to them. And so what we sort of came up with after discussing it for 5 or 10 minutes was this idea of what I'm going to call tactical simplicity. And the idea of tactical simplicity is pretty straightforward. You can spend 15 minutes trying to explain something to somebody in detail and help them understand it. But in today's world, with people's attention span and sometimes just how people think, it's really better to tell somebody something really simple 7 times. One thing simply 7 times is better than one long, complicated thing. Now that seems pretty obvious, but really sometimes we don't do it that way. We try to convince people in long paragraphs and lots of sentences. And what we just finally, because the method here is pretty simple, and you've seen me do it on almost all my videos, that I did it already. If you're here, you got to be here. And so what I was coaching her to do was to talk to her family with her hands in those terms, to just be so simple that they could understand. Hey, I was here and now I'm here. And people say, well, what do you mean? That chemical, it doesn't even matter the name of the chemical. I was here, I was low, and he gave me something to boost it. They don't actually need to even know the chemical, where it's made, what it's called, the structure, the exact mechanism that we propose or guess that it is. None of that really matters if all you're basically teaching is that if I'm here, I'm not good, and if I'm here, I'm good. Or if I'm here, I'm not good, and if I'm here, I'm good. It seems pretty simple, right? If I'm here, I'm not good, and if I'm here, I'm good. So it doesn't matter what chemical it is. If that's what you're dealing with, you just want to not be here. You want to be here, not here or here. Well, sometimes you have to say that 5, 6, 7 times in a row. So that was the idea of tactical simplicity, that I just coached her. I said, look, rather than try to explain it in more depth, just get simplistic about it. Now, Dr. Holmes is known for the guy that's very, oversimplified about this stuff. The fact is, nobody really understands why our medicines work, and nobody really understands how we get better with these things. Nobody understands why we dream. Nobody really understands how we think. We have lots of ideas and thoughts in the year 2026, but the truth is, we don't really understand most of this stuff because you can't take the brain apart and look at it and put it back together. A lot of it is very educated, very technical guess, but we don't know everything about this. So given that we don't know, then many times the solution is just to be as simple as you can be. It reminded me of a patient I saw this morning, actually, who years ago, he had a stroke. So by just by the luck of the draw, I saw him this morning. He's looking great. He's walking great. He's talking great. But when I saw him after his stroke several years ago, he literally couldn't talk. So how did I help him? Well, he had this thing called expressive aphasia, which means he couldn't speak to me. He could understand what I said. Expressive aphasia means can't get the words out. Understood what I was saying, comprehended the words I was saying, couldn't respond back. So I would ask him questions and he would go thumbs up or thumbs down. Thumbs up, thumbs down. Good, bad. And then I taught him, okay, I want you to be here. Where are you now? He'd come in and he'd say, didn't say a word to me, just went. So I would, working the hypothesis of whatever chemical system was at the time, it was either serotonin or norepinephrine or one of them. But the point is that with the system we were working in, he could easily say, yep. He couldn't use the words. And when he walked in and he said, I knew we had it. Now that guy's recovered and he can speak now, which is again another miracle. How do you have a stroke and not be able to speak, and then years later you're able to walk in and tell me that you're doing fine, you're exercising, you've lost some weight, and you're really happy about your life, and describe what he's doing. He described all these things to me literally this morning. Now, how does that happen? That's a complete miracle. We don't understand. But the point is that if you have to be simple, if you have to be simplistic, well, being repetitively simplistic, tactical simplicity is, I think, a good tool that you might want to try. If you're trying to explain to your friends where you are, what you're doing, and how it's going for you. In particular, it actually probably is true with any medical system, any medical problem. You do the same thing with diabetes. You say, hey, blood sugar, bad. Took too much insulin, blood sugar, too low. How's your blood sugar now? It's about there. Good. Okay. That's tactically simple. When patients in your life or when people in your life don't understand what you're trying to do, sometimes just repeating yourself the same way over and over and over, they finally go, well, you're not making it more complicated, so I suppose this is what I'm going to get. And then you move on for the conversation. So I would encourage you to explore tactical simplicity as a tool when you're talking to people about your brain chemistry. The fact that people are engaged in this channel and watching the videos and talking to other people about their brain chemistry and changing the language about their brain chemistry is just really an exciting thing for me. So I'm happy I'm doing it, and I'm happy that you're here. So thanks for watching today. I'm Dr. Dave Psychiatry. Thanks for coming to see me.